Experts with Kristen Levine. On today's show, Dr. Callie Harris, Dr. Andy Rourke, Dr. Lisa Radasta, Alex Sussa.
Hello, pet lovers. I'm Kristen Levine, and welcome to another episode of The Experts, your trusted source for pet care advice. And today we have an incredible panel of experts ready to answer your questions about pet health, behavior, training, you name it. Now remember, if you have a question that you'd like to see answered on The Experts, you've got a good shot at it. All you have to do is videotape yourself asking that question and then upload it at dogtv.com/experts. Are you ready to meet our panel? I am. I'm ready to introduce you guys. All right. First, we have Dr. Callie Harris, a veterinarian who transitioned from emergency medicine to focus on pet nutrition. As the veterinary communications manager at Purina, she educates both professionals and pet owners on the importance of proper nutrition. Welcome, Dr. Harris.
Thank you for having me.
Absolutely. And Dr. Andy Rourke. You know what? I wanted to ask you, are you still doing your podcast, The Cone of Shame?
I am. Every week it comes out.
Awesome. You guys have got to check out the Cone of Shame podcast. Dr. Rourke is a practicing veterinarian, an international speaker, an author, and a media personality, and the founder of the Uncharted Veterinary Conference. So welcome. Thank you for joining us.
Much.
And next up is Dr. Lisa Radasta. She's a board-certified veterinary behaviorist who specializes in diagnosing and treating behavior problems in companion animals, helping them lead less stressful lives. Welcome, Dr. Lisa.
Thank you.
And finally, we have Alex Sussa, a certified dog trainer and behavior consultant. As the owner of Peach on a Leash, she leads one of the largest training programs in the Southeast, helping countless families and their dogs. Welcome, Alex.
Thank you.
All right. So let me tell you how the show works. Some of you have been on the show before, but just as a refresher, we have 4 viewer questions, and we'll have 4 minutes to answer each question. And I've got a little timer, so I'm going to try to keep you guys on track. And then we'll just have a little bit of fun with it and hopefully help out our pet parents watching. Great. Sound good?
We can do this. Yes.
Yeah.
All right, all right. So let's get to our very first question, which comes from Susie in Rhode Island.
Hi, my name is Susie. I have a question for the experts. We recently adopted a dog and she's having some behavioral issues. If we leave the house or if she's not the center of attention, she likes to jump up and urinate on our beds. How do we fix this?
Well, it's a complex problem. I'm going to go to you first, Dr. Lisa, since you are the behaviorist here.
Well, first, we're going to give this little dog some grace, right? So we talk about, and I bet Alex does something similar, we talk about 3 days, 3 weeks, 3 months. When you adopt a pet, 3 days is like shock, right?
Yeah.
And then 3 weeks, we start to see who the pet is. Usually by 3 months, we really see who you're living with. And that's why some people will say, gosh, this dog never barked. And now 6 months later, she barks all the time, like you are seeing the real dog, right?
Yep.
Okay, so let's just give this dog a chance to adapt to the environment. Number 2, we're gonna take a trip to the veterinarian.
Yep.
We don't know if she has a urinary tract infection. We don't know if she has kidney disease. We don't know. What a lot of people do is they adopt their dog, whether it be a rescue, a shelter, a breeder, wherever, right? And they never take it to the vet until the dog is sick.
Yeah.
And that is a real missed opportunity, right? So we want to make sure this dog is completely well. And then once the veterinarian has determined that or not, right, because you might be treating a problem at that point, we're going to think about talking to a highly qualified, positive reinforcement only certified dog trainer to try to look at what's happening in that environment. How can we rearrange that environment or maybe rehouse train this dog, right? And then you may, at the end of the day, need someone like me, a veterinary psychiatrist, but the course is going to be vet, dog training professional, and then me if needed.
Got it. Dr. Rourke, anything to add to that?
Yeah, I mean, this is going to be a big case of family management. You know, it's where I usually see here is, one, there's the part of this is the behavior and we have to fix it. Let's be honest here. When the dog is jumping up and peeing on the bed, most people are not going to be cool about it. You know, like you're going to have a very short runway. Even if people are okay about it once or twice, if this is an ongoing problem, very quickly people are going to start getting frustrated, especially the person who's in charge of washing the sheets. And so
those are husbands.
Oh, that's right. So they're husbands.
To be clear.
To be clear. But it is one of those things too, where as the veterinarian, it was funny. I would say we're going to work on this fixing this behavior, but also I would huddle up with the pet owner and say, hey, look, how are things back at home? Let's make sure we try to set some expectations with the rest of the family. This is going to be okay. We're going to work through this, but it's going to take some time. And so, one, let's think about how can we meet the pet where they are? How can we just avoid messes? But also, let's set the family up to know that there's going to be a little bit of a process. If it happens 2 or 3 more times in the next 2 weeks, I don't want people losing their minds and saying this pet needs to be put to sleep. I don't really need to go that dark, but that happens a lot, you know.
Yeah.
I don't want people to run out of patience on this pet, and so. It might sound like we're going away from the pet, but that really getting the family on board and convincing the family to be patient and convincing them this is going to be okay, but it's going to be a process. I think that's critical for success.
Yeah, that's great advice.
And
Doctor.
I just want to say one thing, because a lot of my clients at this point will say they won't go to the dog trainer because they'll say, I've been to a lot of dog trainers. I've had 20 dogs. I'm 50 years old.
Yeah.
I know how to do this. But what I want to say is, I think that dog training professionals need a different name because it's not always about training. A really good dog training professional walks into your environment and goes, oh, well, why can't you just close the door to your bedroom because that's where the dog's urinating? But then they listen and the family goes, because I have 2 teenagers and they don't listen. And everybody, the teenager knows that they insist on leaving the doors open, right?
We have to assess that whole environment holistically, not just the dog, not just the primary caregiver, but who else.
And you might leave with teaching nothing. And that to me is a huge value. That's a huge value.
Yeah.
But it's the evaluation aspect of it. I mean, when you go back to like the medical aspect too, I love what you mentioned, Dr. Rourke, as far as doing the whole pet exam. You know, a lot of times, especially with urinary challenges, we often will go to, well, that dog is bad behaving or something's going on with anxiety, anything outside of, well, what's going on with the urinary tract, right? So I think it is always great to start with the whole animal before we start to pinpoint other issues.
And I'm not a vet, but I frequently see that when we see this particular issue, the dog has a UTI or some sort of urinary issue.
Absolutely.
That they're going and peeing on the bed. Right. Or they just aren't potty trained. And that's just a convenient, comfortable place to go.
Exactly.
Or they think that no one's going to see them in there because people don't tend to find them. So they're like, this is a place that no one will catch me because they don't understand it's not about going inside or outside. They just don't want to be caught because people are punishing them versus interrupting it, redirecting outside. So they think, well, if I can just hide and do it when nobody's watching or when I think nobody's watching, that's the safest place for me to go. That happened a lot. And so we changed the potty training process a little bit. Sometimes it's a lot simpler than people make it out to be, where they think that my dog is mad at me or my dog, they're kind of giving this really big sort of anthropomorphized idea of what's happening when it really is just a convenient place for the dog to go. And we just have to change it up. All right, let's go to our next question. This one's from Stas in Ohio.
Hi, I'm Stas and this is Gertie. I was just wondering, what is the safest way to travel with a small dog like this to help her stay safe and also to keep her anxiety low during like long car trips?
Dr. Rourke, I'll come to you first on this one.
Oh man, so for small dogs like that, so again, it's funny, people don't put a lot of thought in this, and we have, like I am a romantic myself. Like I grew up with the idea of, you know, the dogs in the back of the pickup truck. I grew up in the mountains, and again, you look at today and you go, that's so dangerous. That's a terrible idea.
I see that.
But, oh, I know, I do too. But I just remember, you know what I mean? There's just something of like, you know, the Labrador Retriever and the pickup truck, and like, I get it, and it's this, like I said, it's sort of this romantic thing. And so I don't mean to pop people's bubbles. However, it gives me anxiety every time I see it. And so there are so many steps that have been made forward in traveling safely with our pets. We don't really talk about them, but there are pets, seat belts and harnesses and things like that. And again, I see when I'm driving along and I'll see dogs running back and forth across the back seat or even up into the front. And, you know, people go, it's kind of funny. Well, if you got a tiny little dog, maybe. But a beagle crashing into your left arm when you're holding the steering wheel is not good.
Or if you're in an accident, I mean, that's a projectional. It's dangerous to not just the dog, but all the people.
It is. And again, I said, that's why I start with the I understand the history of traveling. Sort of the dog hopping up in the back is I get
the whole
it.
family.
The whole family.
Afterward.
Yeah, exactly.
Yes,
I get it.
Yes.
And so I don't want to shame that or anything. However, you know, for small dogs like that, I'm a big fan of a carrier. I really am. Again, a travel crate, like it's the easiest thing. There's smaller dogs. something nice, something that's their space that I can put their toys in or things like that. I can make them feel comfortable, kind of minimize some distractions. Ideally, I love it when they can sit down in the floorboard in the back and, and they feel safe and secure and they're not running around. I just think that that's, for me, that is the go-to. Also, if you have a small dog like that, if you can start to work on those travel carriers and containers, that can actually set you up for air travel as well. If you're going to be taking your dog along, go ahead and getting them. You're already working on those skills, and so it's not a surprise when we go to the airport.
So Dr. Harris, what about traveling with your pet who maybe has motion sickness?
Yeah, so great question. And this happens often, right? And I loved what Dr. Rourke already talked about with, really creating a space where they're going to be confined.
Yeah.
I love a carrier. I think that starting crate training very early on, I think everyone here would agree, is incredibly important, not just for travel, but for, when disasters are really, terrible things start to happen. You got to be able to move them quickly. But if you do have a pet that has motion sickness, there are medications for that, right? And so that is a conversation that you should have with your veterinarian. If you see it the first time, even the second time, we can certainly provide something that can act as a preventative. Something else too, you could do some things ahead of that trip, like maybe not feeding a large amount of food, right? Maybe not giving a bunch of water, maybe not, a fistful of treats throughout the entire trip may not be the best thing for this dog that's a little bit irpy. So there are ways to combat this for sure.
Yeah, and then just when I think about behavior, what about pets that are fearful of traveling, Dr. Radasta?
Yeah, so just to go back to what Dr. Rourke said, there are carriers and then there are crash tested carriers. So the cute carrier you get that is from the designer that you love, because I live in Southeast Florida where we don't have dogs in pickup trucks, we have dogs in designer.
Bags.
Right, and they go everywhere with people. So I want to think about, get online and see if it's been crash tested, which you said about the floorboards. The last thing that I read, so it may have changed, but the last thing I read, the safest place for your dog is on the floorboard behind the driver's seat. Right? Same with your cat. In a carrier that will withstand a crash. You'd have to consider that. And I want your dog to be comfortable, but I much would rather your dog leave that car breathing, right? Than the alternative. If your dog is afraid to travel, the first thing I'm gonna go is motion sickness. And one of the big, I don't know if you see this, Callie, but I see veterinarians prescribing these drugs at the wrong dosage.
Yeah, sure.
There's a motion sickness
Let's amp it up.
Right, there's a motion sickness dose, and then the product is labeled for a nausea dose, right? We're gonna use the motion sickness dose. That's really important. You have to give it exactly as you're supposed to give it.
That's right.
So that's the first thing I'm gonna do, and I'm expecting some change. I'm not expecting a cure of this anxious, we're labeling behavior, but I'm expecting some change. If there's some change, I know there's a nausea component because it's the iterative cycle. I'm afraid of the car, I feel sick to my stomach, now I feel sick to my stomach when I'm in the car, right? So it all feeds in. So we fix that part. Then we work on medicines that help the dog travel if the travel is a need and not a want. So if you want your dog to go to the local coffee shop with you, I'm excited for you. But if your dog's not excited to take the ride, even though they're excited to get there, if they're not excited to take the ride, you're doing damage. So one of the first things we'll do is we will hang back. Your dog cannot go with you. And then when your dog has to go, when it is a need, to the veterinarian and say, we're gonna go ahead and give the medicine. Then we're gonna lay it out clearly for the pet parent. This is the type of work it will take with a qualified dog training professional. It's gonna be months before your dog can ride 15 minutes. Many pet parents say, I don't want my dog to go with me that bad. And I'm in favor of the easy button. If you wanna leave your dog at home, as long as they're happy and safe, we're okay. So we kind of approach it from a holistic.
All right, let's move on to our third question. This one's from Rick in San Diego.
Hey, experts. Callie recently lost her big sister, in which she seems depressed at times. We're wondering if there's anything we should do before we consider getting a new dog to make sure Callie's happy and healthy and adjust comfortably to that.
I know we had this conversation earlier. Gosh, Dr. Radasta, I'll let you take this one first.
Well, so we do think, I believe that dogs grieve, but I want to be really careful here. So I want to give an analogy. I have an amazing husband, been married 26 years. He's just perfect for me. If I lost him in some way, I would hope my daughter would not go out and just find a man she thought was good looking and bring him home to be my new husband. So I guess my point is, because this particular dog loved a certain dog does not mean that's
a great analogy.
And it doesn't mean that she wants another dog. So the first thing I'm gonna do is step back as a pet parent and go, what does my dog want? Does she seek out play with other dogs? Is she the type of dog who, when she sees a dog in my neighborhood is pulling me there, let's play, then okay, she probably does want another dog. Now I'm gonna look at her personality. Who is she? Is she a barker? Maybe I'll get a really calm dog. Maybe I'll search for a calm dog. Is she kind of within her shell? Maybe I'll search for an outgoing dog and find a good match. But here's the thing. If you don't want a dog, don't get a dog. Don't get a dog for another dog.
That's right.
That can backfire. And it's a 20-year commitment.
Absolutely. Alex?
For sure. I mean, I think we see this a lot where people want to fix it and they just like want to make it better for their dog, which like we all understand that, but sometimes it's okay because we all feel hard things and sometimes you have to sit in it. And so all we can do is support our dogs and, like Lisa was saying, give your dog what they need, even if it's maybe not what you wish for them, but if it's what they need, more time with you, more just time even alone. Sometimes the dogs just like, they just need to be by themselves for a little while and they put themselves in another room and that's okay, but just you were there for them. And when they come back around, which they always do come back around to some extent, I feel like they pep up a little bit, but just finding what is right for that individual dog and just sitting with them and however they need to process that.
And you know what I just thought of too, that sometimes happens with that is having, my dog passed about a year ago and it was a long battle with cancer and I wouldn't have known if my cat was sick. I frankly wouldn't have known. And the first thing I did actually after Mabby Schmaff passed is Chewy went to the vet hospital, had all his blood drawn. So this dog might be sick. And because we're so focused on fighting the battle, right? We're not even thinking of the other dog. It's normal, it's natural, don't feel guilty, but let's just get that other dog.
Another interesting component to this too is also knowing your dog earlier on, and all the dogs in your household, right? So like if you have 2 dogs starting off and you have different age groups, right? You can evaluate and determine one dog is super friendly, the other may not be, they're compatible with each other. Maybe considering a 3rd dog in the household before these things start to happen. This is something that I've done in my family, like recognizing that I know Rocco, my crazy puppy, I know that he is very much involved with Noah, our older guy, right? And so, and Noah is also a very, involved pet with the entire household. And so considering another animal in the pet and into the home is something that I will often share with some of my closer friends and colleagues. It's just an idea. If you know your dog and you know that they have that communal experience.
Yeah, that's great. Great advice.
One thing I'll put forward is whenever I see pet owners like this, and they'll talk about, is my dog ready? And people are really interesting, and a lot of times they're not really comfortable talking about their own emotions. And so people will say something like, "I feel like I should get another dog for this dog," and the truth may be, you really want another dog. You really want another dog, but you feel. Like people will feel like they're betraying their, the dog that they lost, or just to get another dog is going to look like I'm replacing this. So they come and they say, "Is it okay for me to get it for this other dog?" And I go, "Do you want a dog? Because if you want a dog, you should get a dog." That's what but it's funny how often that happens. Is this owner spoke nothing of his own feelings. But they're in there, and part of it I say, let's talk a little bit. It's being a veterinarian is part physician for pets. It's part psychologist.
We're the family
for the people. Exactly right.
I mentioned this before. We're the family practitioner.
Yeah, you're exactly right.
Yeah, excellent. All right, so let's go to our 4th question. This one comes from, I don't know if it's Ito or Ido from San Francisco.
Hey, experts. So we have a newborn, and I wanted to know, is this the right time to bring in a dog? What kind of dog? And how do I make sure that they get along together?
I'll take this. No, okay. I know 4-year-old and a 5-year-old house, and can confirm probably not a great time. Is this guy crazy? That's the no thing.
I was like, what is he thinking?
But I will say,
people think that if they grow up together,
that's true.
But the problem is, last time I checked, there were exactly 24 hours in a day. And when you are trying to raise a child, you are dumping a lot of time,
especially at that age,
into that.
And that one's not walking yet.
That one's not walking.
It's a good point, Zero.
Puppies don't just raise themselves.
No.
Like they do. Well, actually, they do raise themselves into creatures with lots of behavior problems. So you have to raise your puppy too. And I think now's not the time to do that. Raise your baby. Get your baby to the point where they are walking and running and can verbalize. This is really important. Usually newborns come into the house. There's a dog, let's say any age. Maybe it's Rose's age, right? And the dog is indifferent. that is a red flag. That is a bite waiting to happen. Either dogs are happy to see the kid, or they're fearful, but it's the indifferent dog who is going to morph into something that you don't expect, and that's the problem.
Yeah.
So then babies start crawling. The dog can still get away because babies aren't that fast. But babies have a low center of gravity, and when they start running, they're like a Ferrari. They're like, maybe like a NASCAR. So they're really fast, right? And so then dogs can't get away fast enough, and they corner dogs. Often, when the studies show, it's when a family member, an adult, is standing right there. It's the most common time that a kid is bitten, most commonly bitten by their own dog or a dog they know well.
That's 77%, I think.
Right.
That's a family dog.
Yeah,
or a friend's dog. It's a dog they know.
A dog they know with an adult nearby. Exactly. It's not the dog roaming the street that's biting them most often. So we want to get that kid able to verbalize. We want to be able to say to the child, when the dog has a bone, leave it alone. When a dog's on a bed, you never approach. So they can learn those tools, because once your dog bites, everything that's happening is that right now we're all learning to sit a certain way, right? We're learning to be a certain way. It's always learning. So once a dog bites, it's not that the dog's awful. That is not true at all, actually. But it's that the dog has obtained a coping tool, but now it's in its tool belt that it will use when it feels that way again, because that happens to be normal. That's what we all do. And that's a really dangerous coping tool. So I don't want the dog to ever be in a situation where they pull that coping tool out of their tool belt. So I want to prevent that learning.
Right.
Yeah.
Well, but I just thought about another angle of the same question. You have a young daughter, right?
I do. I have a 6-year-old.
So what advice would you give to parents whose children are asking for a pet?
Yeah, great advice. Well, first, so great question. I'm going to hopefully give some great advice. So here's the thing, what I tell all of my friends and clients about this, kind of the same line of questioning, like why do you want this dog, right? Is it for you? Is it for your child? Because the answer really needs to be it's for you still at this stage as well. And so this is something that I knew even with my own, and she was born into a household of pets. So it's a little bit of a different scenario. But what I always like to share with folks who want to acquire a pet with a young child is make sure that you are ready to take care of that pet
That they want.
that they want. And this is especially important, especially for those preteens or even teenagers that promise that mom, dad, whomever, I promise this is going to be my dog. I'm going to walk it and feed it. Fake news, okay? Just understand that it is still going to be your pet, right? And so that's really my best advice is just, you can do it, but just know that this is also going to be another responsibility.
Alex, any last thoughts on this one? I know you have kids and dogs.
Gosh, I mean, I guess my final words for this would be, I have seen so many exceptions in our practice that I used to lump everything into categories. Don't ever do this. Don't ever do that. Don't ever get, like, for example, not to start a whole other conversation, like don't get litter mates or don't get two puppies at the same time, which I would not generally recommend. But I've also seen families that do an incredible job and have two very well-adjusted litter mates. So like there's always exceptions. So there are some families that do it. They have a newborn and a puppy. I could never do it. Like, props to you if you want to do it. But there's always exceptions. So you have to know what's right for your family at the end of the day. And you can take our advice. You don't have to take our advice right here.
I love that. An exception to the rule, right?
Yeah, there's always exceptions.
Always exceptions. Excellent. Well, this has been another great conversation and great questions from our viewers. Thank you so much. That is it for today's episode. Let me thank all of our guests, Dr. Callie Harris, Dr. Andy Rourke, Dr. Lisa Radasta, and Alex Sessa. And I'm Kristen Levine, your host, and thanks so much for being here. Don't forget, you can get your question answered. Well, probably. I shouldn't promise that because we get a lot of questions, but if you'd like to ask your question, just videotape yourself asking it and upload it at dogtv.com/experts, and we hope to see you on the next episode of The Experts.